I would like to talk something about the cranial cavity. So cranial cavity is the view. This is the view when you have cut open the skull. There used to be a outer covering here, which you have cut. You have opened it. You have removed the entire brain, and now you are seeing is three depressions, three areas of depression. One is this depressed area, which we call by the name anterior cranial fossa. The second one is this region, which this is again another depression, which we call it by the name middle cranial fossa, and lastly there is posterior cranial fossa. Okay, so this is how the cranial cavity is divided. Now, what are the bones which you see in anterior cranial fossa? There are only two bones which form the anterior cranial fossa. Major two bones, that is frontal and ethmoid, and partly the lesser wing of sphenoid. So these three bones form the anterior cranial fossa. Now this entire one, big one, is the frontal bone. Okay, this is a part of frontal bone, and just below this part lies your eye. So this is the area which forms the roof of your orbit. This area forms the roof of your orbit, and this is ethmoid bone. So this ethmoid bone is present, just behind your nasal bones. Okay, so this is ethmoid bone. So, and also this lesser wing of sphenoid. These are involved or these are the parts of your anterior cranial fossa. Now, what about your posterior cranial fossa, which is the major bone here? This green colored one is occipital. Then you have the part of temporal, which forms the posterior cranial fossa. So what about the middle cranial fossa? You have the major part of your sphenoid and your temporal bone. Okay, these are various cranial fossas. And now, what all things do we need to know in these cranial fossas? We need to know which all foramens are there, which all foramens or what are the contents of these foramens. Okay, we will have a detailed look into those things. Okay, so time being, understand what is anterior, what is middle cranial fossa, and what is posterior cranial fossa. So any question which comes by name saying middle cranial fossa, fracture of middle cranial fossa or something, you should be able to imagine this particular picture. Okay, so there are lots of structures there. This is a picture where all the structures have been marked. So let's study this. How to study this, we'll see in the next slides. Okay, so what I tell people to do is, divide it into anterior and divide it into posterior cranial fossa. Start with the anterior first. So what are the structures in anterior cranial fossa? Now I've told you that there is this particular bone is frontal bone. Okay, there is a frontal bone, and this particular bone is your ethmoid bone, isn't it? You have the ethmoid. Now which part of ethmoid bone is this? This is called as cribriform plate of ethmoid bone. Okay, cribriform plate. Okay, so just so this is called as cribriform plate of ethmoid bone. Now there is one more structure which is supposed to be here. I will just draw it. In this picture it is not seen properly. So there is a foramen here. In some books it is given wrongly that it is part of ethmoid bone. It is part of frontal bone. There is this particular foramen here. Yes, as Amrita, Rahmat and all are saying, it is called as foramen cecum. Okay, foramen cecum. So you have this foramen cecum, which is actually a part of or which is actually situated in frontal bone. Okay, I think pulse somewhere it is given wrong as it is part of ethmoid bone. Correct it. It is not part of ethmoid bone. It is part of frontal bone, but just in front of ethmoid. Okay. So these are the major things to study in your anterior cranial fossa. That's all. This is the only thing you have to study in anterior cranial fossa. Nothing more, nothing less. Okay. So that completes your anterior cranial fossa. Now this is over. So you don't now think about this. Now let's move to another part, that is your posterior cranial fossa, this region. So which is the bigger bone there? Which is the bigger bone there? Or the green colored bone which you are seeing is, yeah, people, I hope you are all listening. Yeah. So this is occipital bone. So you have the occipital bone here, and you have a very big foramen here. Very big foramen. What is that very big foramen's name? You have a big foramen here. What is that foramen? Yes, it's called as foramen magnum. And along with it, I want you to learn two more things. What is this small foramen here? And what is this? Okay. So in this, there are few things I want you to learn. That is, one is this. This is your foramen. Everyone remembers this very easily. Okay. This is foramen magnum, isn't it? And next one is, yeah, few of you have already recognized it. This, sorry, yeah, this one. Yeah. What is this one? Now this one is hypoglossal canal. So what do you mean by hypoglossal canal? A canal through which a nerve by name hypoglossal goes, or it exits the cranium. So hypoglossal canal it's a canal through which the hypoglossal nerve comes out. So anyone knows which is the number of, or what is the, or which cranial nerve is known by name hypoglossal nerve? Yes, 12th. Yeah, somebody told 11. 11 is spinal accessory, or you can simply call it as accessory nerve. So hypoglossal canal, through hypoglossal canal, you have the 12th cranial nerve, that is the hypoglossal nerve, which is going to pass. Now, finally, I would like you to have a look into this particular structure. So that is jugular foramen. So what are the structures by name jugular which you have come across? Which is a structure by name jugular which you have come across? Some vein have you studied? Internal jugular vein. Yes, very good. Internal. So this is the place. Yes, there is internal and external jugular vein, and this particular foramen is the place from which the internal jugular vein exits the cranium. Clear with it? Okay. So this completes your posterior cranial fossa. Done. That's all. Now you have the foramen magnum. You have the hypoglossal canal. Once again. Yeah. Hope everything is clear. Yeah. So in this another thing I want to talk to you about is the, one second. Yeah, regarding this part of, Is the screen okay now? Is it fine now? No. Wait. Now? Yes, yes, yes. Okay. So I hope we didn't miss anything. Yeah. So some trouble in between. Okay. Now I also want you to learn this particular part, this particular region of your occipital bone. So what is that part of occipital bone known, or the name of that? Can you name that part of occipital bone? This region I'm talking about. Now this is known as the basilar part of occipital bone. Okay, the one which I've painted in purple color now. So that part is known as the basilar part. Okay, just wanted you to remember. Later we might come across this particular term later. Okay, so this is known as basilar part of occipital bone. Okay, so now middle cranial fossa I'll discuss separately some other time, not now. During the time of sphenoid bone I'll discuss. Okay, so that completes your anterior cranial fossa and posterior cranial fossa. So there are many structures, and we have covered the structures in the posterior and anterior cranial fossa. I've not talked about air sinuses. That I'll talk later. Okay, so what are the contents of jugular foramen? So jugular foramen is divided into anterior, middle, and posterior part. Okay. Today I want you to focus attention mostly on two things. One is the middle part, which are the nerves which pass through the middle part. Can you name these nerves? Can you name? I'm waiting for your answers. Can you name which is the ninth cranial nerve? Okay, ninth cranial nerve is glossopharyngeal. Okay, it is glossopharyngeal. Now, as the name says, it travels to the tongue and some part of vagus. Okay. Now, what is the 10th cranial nerve? Yes, many of you have answered already. It is the vagus. And 11th is accessory nerve. So accessory nerve has spinal and cranial parts. Okay, it has spinal and cranial parts. So one part comes out through jugular foramen, one part comes out through foramen magnum. So today, study about this 9, 10, 11, and also you study about the internal jugular vein which is coming out through it. Okay, that's all for today's this thing regarding jugular foramen. So jugular foramen, you have seen the picture. So it is related to 9, 10, 11 cranium, or the 9, 10, 11 cranium comes out through this, and also the internal jugular vein. Rest of the things we can discuss later. Okay, and this is a picture of it. I've given it in your notes. And then you have something called as foramen magnum, big foramen. So you have the medulla coming out through it. Then there are some arteries which enter the cranium through foramen magnum, that is known as vertebral arteries. Spinal root of accessory nerve is there. I told you accessory nerve has two exits. One is through the foramen magnum and one is through the jugular foramen. Then there is a ligament around the dens of the cervical vertebra. Then there is a membrane called as membrana tectora, and there are certain spinal arteries. So I remember it as MV SAM. So M for medulla, B for vertebral arteries, S for spinal root of accessory nerves, A for apical ligament of dens, membrana tectora, and spinal arteries. Okay. So I'm just stressing on these two. I'm just stressing on foramen magnum and jugular foramen. Okay, so that is regarding the posterior cranial fossa.